Hemorrhoid removal. Let me try to answer some of your questions. Questions like, how do I know I need surgery? What kind of doctor should I see? What are the risks? What should I expect before, during, and after surgery? Will they come back? Here's a few answers, and in a minute I'll give you a link to an excellent article, which goes into your hemorrhoid worries in far more detail. If you have substantial pain or bleeding, there's a good chance you may need surgery, so now's the time to speak to your doctor for a diagnosis. He may do one or other of the following: an anal examination using a finger, an anoscopy using a small lit tube called an anoscope. He may use a proctoscope or perform a sigmoidoscopy. Or finally, on rare occasions, a colonoscopy. Don't panic. Unless the doctor suspects anything sinister, he'll normally only use one of the first three. Doctors generally perform one of two types of surgery to complete hemorrhoid removal: stapled hemorrhoidectomy or conventional hemorrhoidectomy. With stapled hemorrhoidectomy, the surgeon staples prolapsed hemorrhoid tissue back into its original position. A standard hemorrhoidectomy removes the hemorrhoid, blood clots and blood vessels that feed the hemorrhoid. It's normally done in outpatients. He may suggest other procedures which are far less intrusive, such as excision, which is used to remove the blood clot of a thrombosed hemorrhoid. Sclerotherapy, a solution is injected into the hemorrhoid, cutting off the blood supply. Laser, a laser is used to burn the hemorrhoid tissue and block the blood flow. The best people to do these operations are colorectal surgeons. Before the surgery you'll be given instructions on how to prepare, such as when to stop eating and how to empty your bowels before surgery. You'll also need someone to drive you home after surgery. During surgery you'll have some form of anesthesia and you may or may not be awake. After surgery don't drive for 24 hours. Don't sign important documents because of the anesthetic. Don't operate machinery. And keep off of alcohol. And finally, don't lift anything heavy. You'll probably need some pain medication for a few days. Remember to keep your stools soft. And take sitz baths. Common complaints after hemorrhoid surgery are spasms and pain when going to the toilet, or itching right after a bowel motion. You may also feel like you need to go more often. The main risks with hemorrhoid removal include pain and bleeding, infection or incontinence, bloating and gas, or a bad reaction to the anesthetic. The success rate for these operations is about 95%. The recovery period can be anywhere up to 6 weeks, but is normally around 3 weeks. Judging the cost is difficult as different areas vary. We have seen prices for a hemorrhoidectomy between $5,000 and $12,000, so you need to shop around. Other treatment can range from $500 to $1,500. This is just a short video, but I'd like to answer your questions more fully. So please find a short link in the description below this video, which will take you to a comprehensive article, which will answer all of your questions more thoroughly.